Hey guys, Dr. Dylan Greeney, board certified dermatologist, here to help you get your best skin. Thanks for being here. Thanks for hopping on. If you guys have any skincare questions at all, feel free to ask. I'm here for you guys, so you can just drop any questions you got in the chat. I'm literally here for you. So if they got friends that love skincare, invite them. If you're here to support the channel, tap the screen. It makes a big difference. Rosacea treatment that doesn't involve antibiotics. Well, a lot of them they don't all have to involve oral antibiotics, but there are some antibiotics like metronidazole that are topical. You can also do azelaic acid. Azelaic acid you can get over the counter. It's a real nice treatment for the bumps of rosacea. Really, really nice for that. So how to get rid of post-inflammatory erythema. So that's the little red spots you get on your skin. You get the red spots on your skin that happen after you get an inflamed bump. So for those reasons, you can do laser for that. I like BBL. I like IPL, XLV. There's a lot of different options you can do in that regard. So there we go. Cool. I just making sure the stream was going. So perfect. Eczema for kids. So good moisturization after showers. Moisturization for eczema is the key to keeping eczema down and keeping it pretty happy. So I definitely look into some real great moisturizer use with eczema. Now there are steroid-free topicals that can be used for eczema. Injections like Dupixent can be really good for some more severe eczema forms. So that can be really, really helpful. Maureen Green says, what can cause a really itchy scalp that does not flake and does not respond to dandruff shampoos? So if it's not flaking and things, you can have nerve damage in the neck that sometimes can cause an itch sensation on the scalp. There's other conditions like dermatomyositis as well that can cause itching on the scalp. So those are reasons if you're having those troubles, you want to see a dermatologist, make sure you get an accurate diagnosis of what's going on. Lucky Stirs, thanks for the roses. I appreciate it. And Maddie, again, thanks for the good games. I appreciate it. Accutane's 11 months and still have red spots that look like flat acne. So hard saying. I don't know if maybe what you're talking about, Dan, is a post-inflammatory erythema. It definitely could be that little fallout from the acne that was there. But again, laser treatments may be a benefit to you and help that kind of go down. Seborrheic dermatitis. So Steven, there is a new treatment that's kind of come up for seborrheic dermatitis that you get over the counter. It's called Vichy Durcos, Vichy Durcos. It's a really nice new innovative shampoo that can be used for seborrheic dermatitis. And I was kind of part of the team of dermatologists that kind of helped get it to the market and everything. It's actually the most popular treatment that's available in Europe, and it just came to the United States, so you could try that out. Scalp psoriasis, again, medications, there's not a lot you're going to get over the counter, but things you could try over the counter. The Vichy Durcos actually might help. DHS tar shampoo may help. These are good options. Sulfur ointments, I've actually never used any sulfur ointments, so I'm not real familiar with those, but that's something you can look at. So that is amazing. User 1418 says, I want to thank you, Doc. Because of you, I'm dandruff free for over 3 months in 15 years. So that is like amazing. And I'm actually gonna have to take a picture of that because that made my day. So thank you so much. That's awesome news to hear. So if I'd love to hear what you used, user, and let me know. Home treatment for molluscum, you can actually put some acne treatments on it, like benzoyl peroxide, that can irritate the skin and get your skin to clear that faster. Maureen was asking next question, and now about flaking beneath mustache and beard that does not respond to washing with either dandruff shampoo or salicylic wash. So if you're having that usually is seborrheic dermatitis. It's like dandruff of the face, and usually those anti-dandruff products usually will help it, but it can be challenging. Sometimes you need a little bit more treatments like topical steroids that can help that. Dupixent's the best medicine that there is for eczema, and it can clear your skin completely. So Dupixent's a real miracle for people that struggle a lot with eczema. Mia, thank you so much for the heart. Mia, it's good to see you. Mia, are you still playing any Call of Duty, or are you off that now? So last live, where are we going next? So Meg, I don't know. As you guys know, I am on Instagram. You guys could follow me there. YouTube, SwoleMD Skincare on YouTube. I'd love to have you guys over there too. So I'm hoping this is going to still be around, right? I don't want to leave you guys. So let's see. You, Meg, you definitely have mod wherever we go. I still play. Still says, when will you guys be on? I don't know. Maybe maybe we could. I don't know. Maybe we'll hop on a roll a little bit tonight. That would be kind of fun. I don't know if we could get Boolong on. I could send him a message and see. So I don't. Yeah, Sulfur always online too, Greeny. Well, thank you, Meg. I appreciate it. You have the member level 2, Meg, which is awesome. Looks good. Meg's been around a long time. Affordable treatment for texture and scarring. So there's probably one thing that can help better than anything else for the concern of texture and scarring, and it's going to be retinoids or retinol. So I would say over the counter, I would get La Roche-Posay adapalene, but any kind of retinol-based product can help to stimulate collagen, remodel scars, and also help smooth skin texture, because usually they're going to help to thin out the dull dead dry skin on the surface, which can give that texture and bumpiness, and help in that way. So that's really going to be the main thing. Now there's of course other stuff you can do as well, but Denny Morgan lines, thank you so much for the TikTok balloons. Those are super cool, Mia. I hadn't seen those before. Thank you. It's interesting how some of this stuff animates and some of it doesn't on the screen. So thank you. Evan, thanks for all the roses. I appreciate it. Vanicream is really good for body eczema. So Vanicream and Aven, Avene, are some really, really nice options when it comes to general skincare, especially with people with eczema and stuff like that. Denny Morgan lines, a lot of times those are little lines that come up around the eyes and stuff like that, and in people with eczema. And usually using like non-sedating antihistamines to kind of lower that allergic response that people get, that can help. What do you do to get the glowing effect? So on my skin right now, Meg, hey, thanks for coming over to YouTube. I appreciate you. What I do to get the glowing effect. So right now on my skin, I have the Charlotte Tilbury Glow Toner. I have Drunk Elephant Marula Oil, and I have Peter Thomas Roth Water Drench Moisturizer. Thanks so much. Appreciate it. Photos by me. Thank you for the heart me. Appreciate it. How to get rid of strawberry skin. And oh yeah, Mia got finally at month 6 for skin sub. Thank you so much. I appreciate it. Mia is actually member level 3. So you've been a subscriber for a long time, Mia. So thank you so much for all your support of the channel and helping us get dubs on Call of Duty. So that's what I have on my face right now. Now I do have good lighting, right? So the lighting helps a lot. I have a light kind of back here too. That kind of gives me that nice little shine on my face there. So that's what I got going on. Tenia Versicolor. I actually want to show you guys something right now. That's because it's like revolutionary when it comes to Tenia Versicolor. So give me 1 second because I'm going to show you guys something. Is this going to focus up? Sometimes it focuses on All Might and then it doesn't want to focus on me. I don't blame it. All Might's much more handsome than me. I don't know what it takes. What's it take? Focus. Focus, please, camera. There we go. Okay. That's too funny. All right. So I want to get back Tenia Versicolor. I want you guys to think about ringworm, Tenia Versicolor, fungal acne. Here's so the other person that had the trouble with dandruff, they had used Briogeo shampoo for one day and Nizoral the other day and wash every single day. So the people that are struggling with dandruff and dry scalp, if you're not washing every single day, then you're doing it wrong. Briogeo shampoo, really awesome for kind of removing that excess flakes and scale. And the Nizoral is going to kill some of the Malassezia yeast that causes the dandruff. So, but anyway, back to Tenia Versicolor and ringworm and stuff. This is SwoleMD. This is a medicated bar soap that has miconazole in it. So for the people that are struggling with Tenia Versicolor and that, this is incredible for it. Okay, so that they also make a body wash. So SwoleMD is incredible when it comes to that. Okay, guys. So I definitely highly recommend using this. So yeah, definitely give that a try if you guys are struggling with the a fungal acne or anything of that nature. It's very key. So I definitely look into that. So again, the Scrub MD is key. You do not owe me your life. That is too funny. You're awesome. I'm just happy to hear that you're doing better, honestly. Subcision, great treatment when it comes to acne and acne scars. So what happens is you can have a lot of different kinds of acne scars, right? You can have boxcar acne scars. You can have rolling acne scars that are almost like a little divot on a golf course. And when you do subcision, it kind of loosens up the skin underneath the scar and allows that divot to raise up. So that's a great option. Applauser 33333 says best way to prevent acne right before the period. Really, the best way to treat it would be using a medicine called spironolactone, or possibly getting on an oral contraceptive pill. Those are usually the best ways to do that. So lines on the forehead, by far the best way to treat them is Botox. I have Botox now. My Botox is wore off, and you can see, like, when I lift my forehead up, you can see those lines. I just gave myself the Botox a few days ago, and my skin looks natural. I look like myself. I don't look weird or anything like that. When Botox kicks in, it relaxes the forehead muscles, makes those lines go away. It's really, really nice. Getting rid of milia, you have to just you can go to dermatologist or esthetician. They can do some milia extractions. Using a great retinoid is the key to keeping those gone. So Osarug, hello, thanks for being here. And Miss Amy says, I like my skin, so thank you so much. I appreciate that, Miss Amy. And then Joanne says, please tell me how to get rid of hormonal acne. I'm 47. So a lot of times hormonal acne usually probably wouldn't happen at 47. I'd almost guarantee you probably have rosacea if you're fighting like kind of these acne like lesions at age 47. It's probably rosacea. The best way to treat it in my patients is I like using a triple cream that's prescription. It has azelaic acid in it, metronidazole, and ivermectin. And there's probably nothing I've ever used that's better for it. A quick fix for it is doxycycline, but that's not something you're going to want to be on all the time. So Zip from Thanksgiving. Oh my gosh. Well, you can maybe see a dermatologist for that. They can maybe inject it or pop it. 3 dermatologists. So Noah, you just got to shoot the question on here. You don't need to ask if you can ask a question. Obviously, there's hundreds of questions rolling in. So just feel free to ask. Facials and chemical peels worth for anti-aging, or would microneedling be better? It just depends. Both are really good. Microneedling in general is going to go a little bit deeper. So maybe for collagen stimulation, your microneedling is going to be really good. You'll find some people that will do a mix of microneedling and peels, but you got to be careful. My name on Instagram is SwoleMD. So it's the same name on here as on Instagram. If you guys search for SwoleMD on IG, and I don't know if I post a link, if it's going to if it's going to shut it down on here. If it's going to ban me, you know what I mean? So I'll put a link in the chat right now. That's my IG if you guys want to follow me on there, okay? I don't know if Meg, if you can pin that, that'd be helpful. So yeah, so the items I mentioned is something MD. It's called Scrub MD, and it's a miconazole type of treatment for ringworm, fungal infections, fungal acne, those kind of things. So is dermatitis not getting cured? How to cure it permanently? So it all just depends on the type of dermatitis. Something like contact dermatitis could be cured by avoiding the contact allergen, but dermatitis is just an overarching term. It doesn't mean something specific. So yeah, Carrie and Pasta Dent, thanks so much for the follows. I appreciate you guys. I always appreciate all the new followers on here, even if this might be our last time together on TikTok. So thank you guys for being here. How long for azelaic acid 15% to work for acne scars? So azelaic acid is more for fading hyperpigmentation. So scars themselves, it's probably not going to help, but it definitely can help fade hyperpigmentation over a period of months. So you should be able to look at like a before and after 3 months, after, and notice a difference for you. Do I recommend EltaMD sunscreen? I absolutely do. However, today I did a very awesome video on 4 different sunscreens that are very unique and cool. All of those sunscreens are very nice too, but EltaMD sunscreen's been historically one of my favorite sunscreens of all time. So I really, really like it. So eczema, itchy bumps on the hands with redness, you're probably going to want to look into seeing a dermatologist for that, get an idea of what's going on there. 5K likes. Thank you, user 148. Appreciate it. Yeah, we're at 5.4K taps. It means the world when you guys tap that screen. It lets TikTok know that we're helping everybody get their best skin. Scalp smell, but my Nizoral hasn't seemed to help. You can maybe use a little bit more of an, and you can use a little bit more of like an exfoliating shampoo as well. Maybe use something like the Briogeo Mega Strength shampoo. Peptides are worth it. They hydrate, they can stimulate collagen production. They're very good in that regard too. 63 is actually a very common age to develop psoriasis, one of the most common ages to develop psoriasis. Most people on average develop psoriasis around age 30 and around age 60. Nasolabial folds and you're scared of fillers, it's possible that you could look at things like M-Sculpt Neo for the face. Dishitha, thanks for popping in here. It's good to see you. Thank you. So fillers are going to be good. Another option would be using things like Sculptra or Radius, things like that as well. Tretinoin versus Tazarotene. Mia, I don't know if you saw, but apparently I think Dr. Shah Doctorly on the YouTube channel, they did a Tretinoin versus Tazarotene 18-minute video, and I was actually watching it myself. But I think the long story short is Tretinoin's a little bit more common, a little bit easier to tolerate. Tazarotene may be a little bit more effective on certain things. So 99% of the time I write for Tretinoin, but I think Tazarotene is a nice, stronger option overall. So hair plant and transplants in Turkey are safe. I'm sure any type of transplant, no matter where you go, has risks. I think that the biggest issue with doing traveling for medical procedure is if there's a complication, you're not there anymore for them to help you with it, and you're kind of stuck on your own. So I personally think it'd be better to stay in the United States and get the treatment, so that way they can help you with complications as they arise. Hyaluronic acid thinning skin, absolutely not. Hydrated skin is plumper, it's juicier, it's thicker, it looks better. I love hyaluronic acid. It's non-irritating and it doesn't thin your skin. Best moisturizer for a teen, I really like CeraVe moisturizing lotion or CeraVe moisturizing cream. Those are all very good. So what is the root cause of scalp psoriasis? It's a dysregulation of signaling in the skin. So that's why you see a lot of things that are used to help control that dysregulation as medications. So that's what it is. We know certain things like obesity and alcohol consumption can make it worse. And then because of risk factors, if you don't have psoriasis, you definitely never want to smoke, because you're going to have an increased risk of stroke and heart attack too. So definitely don't do that. Risk buying clobetasol, the biggest risk with any topical steroid solution or cream or ointment is going to be skin thinning. So that's the thing you're going to have to look at. Benefits of collagen orally, improved wound healing, but I kind of look at it as almost like taking a protein shake. It's going to be like protein in your body, and good price for Botox. Botox has gone up and up. The price that the company is charging doctors and, everybody's injecting it is more and more. I charge $13 for Botox, and I'm on the cheaper end in my city. So, but I see some people that charge even $17 in my city. Just depends. Nizoral and cyclopyrox for sebderm, nothing stops the itch. So Jordy, again, I would try maybe adding in that Briogeo Mega Strength shampoo. Also consider adding in Vichy Durcos, Vichy Durcos. So that's a really good one. If you guys want to, I'm going to drop my Instagram in the chat too, guys. So that Instagram there, if you guys want to follow me on the Instagram link right there, you can follow me. Interested in the field of dermatology. Where did I go to schooling? I went to Southern Illinois University for my undergrad. I got a biology degree, minor in chemistry and economics. Then I went to Oakland University, William Beaumont School of Medicine for my medical degree. And then I went to Indiana University for dermatology residency. Can you drink and smoke on Accutane? It's definitely recommend not to drink one on Accutane, because Accutane sometimes can increase your liver enzymes, and you don't want to do things that have overlapping harm, right? So obviously smoking is one of the worst things you could do for your body and your skin. So I don't recommend that either, but definitely drinking and Accutane is not a good combination. Joy, thanks for the follow. I appreciate you. Ben went to IU. Awesome, Ben. Thank you so much. I just saw that I got a medicine, or I just became like a adjunct faculty at IU because I was helping to train some of the like med students and stuff. And I got a magazine mailed to my house, and I guess Bill Gates just recently went to IU campus to the School of Medicine, which is kind of cool to see him in an IU jacket. I thought that was kind of cool. So, what advice to lifestyle lead to have fewer problems with skin HPV? So yeah, HPV. You know, there's like 150 different strains of HPV. A lot of people can get on the feet and the hands. Things like walking around barefoot in the gym around the pools, things like that. If you're worried about the more worrisome types of HPV, like HPV that can infect your throat or your groin and potentially cause cancers like throat cancers or cervical cancers, and also anogenital cancers, then getting the HPV vaccine is very important. Risk factors like oral sex and and being not vaccinated, or not getting pap smears regularly when you're due for them. These are ways that HPV can get out of control, cause cancer that obviously could be life-threatening. So scar healing suggestions for Mohs: follow the instructions of your surgeon for one, but the other thing that you can do is wear a silicone gel scar sheet on the scar. That could really make a big difference. Other things that we do for that is things like using Botox around the scars. It stops the movement of that skin and allows it to heal more naturally. Rinvoq is fairly, like, I think it is more risky than other things. Definitely if you have a history of blood clots, if you're a smoker, you wouldn't want to use it. Skyrizi, I use it all the time. I feel like compared to the rest of them, it's just as safe as the other ones. So I do labs for that. How to not look super pale without tanning beds. So Ethan, I would say for that, you can use like artificial tanning drops, or you could use like artificial like topical bronzers. Drunk Elephant makes some. The tanning drops, I like using the only ones I've really tried is the ones from Joa Beauty, Joaa. Dikshitha says no opinion on Revenage. I haven't used that, so sorry. I haven't used that one. I always try to like give you guys recommendations on things I've used. Check out my recent videos, guys. A couple things I did. I know it's like timely videos, but dry winter skincare, some of my favorite moisturizers for the winter. I also just did a video on 4 unique sunscreens, and 2 that fight hyperpigmentation directly, one, and then another one that's a mineral sunscreen. And the other one had a unique benefit of having it basically has these like, they call them like diamond particles in it. It basically kind of blurs the way that light hits your skin and kind of reduces the appearance of wrinkles in that. So Gracie, I would check out my most recent video on that moisturization that we talked about. Yeah, it's pretty fast. I'm trying to answer you guys' questions, but you guys are awesome. Thanks for being here. Lots of questions here. I don't even know how many we've had over this time. Almost 10,000 taps, guys. If this is helping you guys tap that screen, I hope that this isn't our last live on TikTok. But if it is, you guys can find me on, once again, you guys can find me on Instagram at SwoleMD Skincare is another place where you guys can get me at. Or you can just pop on over to YouTube at SwoleMD Skincare on YouTube. So please give me a follow over there. I'd really appreciate it. Woman of Jazz, thanks for the follow. Appreciate you. Hormonal acne, again, the way to treat that really is with spironolactone. You can also use Winlevi, which is a prescription that can be used for it. It's very good. Denny, thanks for the follow. And Nandy, thanks for the follow. You guys rock. Seborrheic dermatitis on the hair and face. Nizoral shampoo is a face wash, and using Vichy Durco shampoo. These are good ideas. Droopy eyelids. So I do a treatment. What is this? Let's see. Hey, love. How are you? Want to say hello? It might be the last TikTok. Just speak in and say hello. What do you say? Okay. My sweet wife is here. I love her. You gonna say hello, everyone? Say hello, hello. Look at my sweet, loving wife. She's sweet. Bad side effects to Dupixent. It's an incredibly effective treatment for eczema. Probably the most effective treatment. They said hello. D and photos by me said hello. Ben says hi, wife. And Woman of Jazz says hello, wife. Carrier oil I haven't used. Drunk Elephant Marula oil is one of my favorite. I heard you can get a dupe from The Ordinary, that's very good too. Can I use a topical zinc with penoxyl? Topical zinc with penoxyl. Yeah, I mean, that's no problem. I don't think that's a problem at all. You know, one of the moisturizers I recently talked about is from Avin and has some zinc in it. So I think that's a nice option. Pretty much if you're using sunscreen, which all of you guys should be, that's going to have zinc in it too. How to fix skin atrophy. So a lot of skin thins with time. Using retinoids on that skin can help it. If it was atrophy from steroids, sometimes there's little you can do, but things like fractionated lasers sometimes can help to boost skin thickness. Been using tretinoin and my skin is so oily now, what to do? That's surprising because usually your skin's going to feel less oily. Dealing with deep scars, things like microneedling and ablative lasers, learn here. That's really your best bet for it. Beef tallow lotion, no, not about it. Favorite lasers for redness and general aging, PDL, BBL, IPL, XLV. These are all really good options. I got skin atrophy at 19. How can I fix it? So I answered that question. Thanks for being here. No need to spam. Shampoo for dissecting cellulitis. I think if there's one shampoo you're going to use and you're having the trouble with dissecting cellulitis or other scalp issues, I would use CLN shampoo. CLN shampoo. So how much finasteride a day to prevent this slow male pattern baldness? Usually I just do 1 milligram a day. 1 milligram a day. Can I mix niacinamide and retinol? So learn here. That's a great question. That's one of the best combinations that you can do, actually. So I strongly suggest actually doing that. Niacinamide can help strengthen your skin barrier and make your skin tolerate retinol better. So I think that's a great combination. Best retinol for a beginner, just day. The best one that I know of that's a beginner one, actually I'll give you two. One of them you can get a 40% discount on if you want, but you can look up Brandify retinol. And that one, if you use the code, I will put it in the chat, but Brandify retinol, if you use the code Greeney40 on the website, that you can get 40% off of. But another one that's very, very good is Rock. And you can get that one at your local drugstore. But Rock is very, very good. Conrad, congrats on your 43 units of Botox. I just loaded my face up with 100 units of Botox the other day. So I'm like 3 days in. So hope you love it. 43 is a very reasonable dose. Mercy, thanks for the follow. I appreciate you. How to get rid of chicken skin. So Joel, chicken skin, best option is doing CeraVe SA lotion, and I also like Emlactin lotion. These are good options. Misha asks, 53, lost 150 pounds. That's incredible, Misha. Congratulations. Asking about facelift, is that your only option for sagging neck skin? And I will say yes. Anybody that's trying to tell you otherwise, they're going to just take your money and you're not going to get the result. If you're trying to get rid of that much sagging skin and get that kind of skin tightening, your best money is spent on surgery. So Joanne, how do you get rid of cystic acne? It's very painful. So Joanne, I think you asked about acne just a moment ago. So cystic acne, there's only one real promising treatment for cystic acne, and that's Accutane or isotretinoin. And you could use that, usually do that for a period of about maybe 6 to 9 months. And it usually puts acne to rest forever. I know we talked a little bit about your acne at your age and a lot of times rosacea. The reality is actually sometimes actually Accutane can actually help rosacea too. Alistair, thanks so much for being here. Super good to see a familiar face. Thank you, Alistair. How you doing today? So Ollie Oates, thanks for following. Bailey, perioral dermatitis, a few tips on that. It's most similar to rosacea. Over the counter, some of the best stuff you can do for it is azelaic acid. So you can get that from The Ordinary or Naturium. Trying to think of other brands you can get azelaic acid from that's good. Paula's Choice. So those are all good options. Make sure 50 units, $500 for 50 units of Botox is incredibly reasonable. That's as good as a deal as you could ever expect. My insurance won't cover Skyrizi. I have tried everything else. What can I do now? It's really tough. Sometimes if you have private insurance, you can look for coupons from the brands or look at brand provided assistance programs that can help you get that medicine. Getting rid of greasy nose. So Connor MD, probably your best bet is using things like niacinamide. I really like the Kiehl's niacinamide. That's a very good option. So I look at Kiehl's niacinamide. I think that would be a really, really good one for you. This is not about cosmetic. I just want to know how to match into a derm residency. Yeah, it's very hard. Derm is hard. You got to get great grades, be a personable person, try to be helpful and engaged when you're rotating. You got to go to medical school. You know, it takes 12 years of training to become a dermatologist. You got to be the top of your class. So for example, like when I went to medical school, I graduated the top of my class in my undergrad, 3.96 GPA, graduated summa cum laude. I went to medical school. I graduated in the top 10% of my class, got an AOA distinction, which is Alpha Omega Alpha Honor Society. I did many away rotations in dermatology. You got to do some research, get published. And then when I got to derm residency, the path to that is 600 people from the top of their medical school classes will apply to dermatology. My program can interview only 30 of those people and accept only 4. So they accept 4 people out of 600 per year. So it's really hard. It's a lot to get into it, but super blessed. I became a dermatologist, and people got amazing stories. You got to take it day by day. It's really hard. How'd you get AOA? I had to be top of my class. You got to volunteer. You got to research. You got to get great grades. It's, you know, it's hard, and it's not like I just apply for it. You know, it's your medical school kind of picks you, right? Best for cherry angioma. I've helped a lot of people. I've helped a lot of people with cherry angiomas, and really just doing, I like laser for them. Usually one laser treatment will get rid of them. So that's the way to do it. So Accutane's the best medicine there is for acne, the only thing that can cure acne permanently. So I love it. Jasmine, thank you so much. I feel super blessed. Best sunscreen for everyday use that's light and not heavy. I would say watch my video I posted today. I reviewed 4 great sunscreens. I've really been in love with Peter Thomas Roth water drench tinted moisturizer. I love it, and it is exactly what you're talking about. It's super good, so I checked that out. Neurosurgery is a plan B. Jeff, the other thing I'll say is, you know, obviously both competitive fields, very different lifestyles. Obviously neurosurgery, you're going to grind for your whole life. Usually there's only 1 or 2 of you, like in a healthcare system, so you've got to wait on your shoulders your whole life. I will say this: if you have any kind of plan B, generally, then probably both of these fields are not going to let you in. So you got to have a plan A and only a plan A if you want to match into either of these specialties, in my opinion. So if you have a backup plan, usually either field, because there's so many dedicated people that want in, they're going to give it to somebody else. So I know you can do your best to like kind of keep it close to your chest, but sometimes the word gets out and that can be harmful for you. What's the biggest dermatological hoax? Biggest hoax? I don't even know, dude. Like, what's a hoax? Cab Trio, great option overall. 3 great medications. Is the cocaine in there, love? Did a nice job.
It's black sheets, not green.
No, they're green.
They're black.
Nope. No, get close. They're green. So it includes 3 of the great babe knows. I know the coloring. No, I love you. I know the colors. I start prereqs for nursing Tuesday. That's so awesome. Congrats, Mia. When you're ready to move to Southern Indiana and join my team, let me know. We'll get you in here. So that's awesome. You know, I think you know, but I was a nurse before I was a dermatologist, so got a lot of love for the nurses. So that's awesome. Congratulations. Nursing, I know, ain't easy, especially you got the kiddos and stuff, but you stick to it, you're going to get through. You're going to be an amazing nurse. So derm's awesome. Monica L, thanks for the follow. Appreciate you guys. I thought I had Amelia, but it keeps coming back. What could it be? It could be a little cyst, Tori. So it could be actually like a proper cyst. So it could be that. Thank you guys for being here. Appreciate you guys. Anything to do for wrinkles while pregnant or trying to conceive? You can use acids like glycolic acid. This is class A. That would be awesome. So excited. Thank you. You're welcome. You're going to do amazing. Can you become a dermatologist and plastic surgeon? There are people that are dual board trained, but you're talking about an incredibly long journey. I mean, if you talk about taking 12 years to become a dermatologist, it might be an additional like 5 or 6 years or something to do the surgical part of it. So you might be in like residency type situation for like 17 years or something. It'd be forever. Most people don't do both, obviously. What should I do with pustules? You know, CLN is really good. Red cheeks in a teenager is kind of common. It could be just a normal type of skin concern. However, you can do some lasers for those. Donna Curry Aesthetics, thank you so much. She said, I had a couple of clients that have been to me, have done great work. I appreciate it, Donna, and I love hearing the feedback. Thank you so much. I love just natural looking results. You know, if anybody ever comes to see me for cosmetic treatments, like my whole goal is you're going to get what you paid for and you're going to have a noticeable result. And you know, if you trust me with your care, especially if you give me some downtime, I can make an incredible transformation. But everybody looks very natural. They look like themselves. So I think Differin is the best retinoid you can get over the counter. Differin or adapalene from La Roche-Posay. These are very good. Epic Burrito. I love that beautiful skincare badge on there. It's great to have a great it's great to have an awesome subscriber in the chat. So thank you for being here. Love to see it. Love to hear miracles. Yeah, CLN's one of my favorite things. So biologic coordinator for dermatology in Lansing. Shanda, that's awesome. That's not an easy job, is it? Biologic coordinator, man. You deal with a lot of paperwork, a lot of headaches, but you get to people their medicine and you see how much it improves their life. So it's very rewarding too. Warts on the feet. I got a few videos on that particular topic, actually. Would you guys, I know this might be our last time on TikTok, you know, if it gets banned, would you guys come over for a live on TikTok with me or a live on Instagram? Would you guys join me if I went over for live on Instagram right now? Would you guys hop over with me? I was thinking about maybe throwing it up on the phone and doing a live over there if you guys want. It'd be awesome. That'd be super cool. I'd really appreciate you guys come over and join. I mean, I love TikTok. TikTok is my platform, man. This is what I got my best community on, but I'd love to have you guys over there. Carla, I love Botox under the eye. That's called the jelly roll. It can really smooth out that under the eye. The only time that it's G Miller, I agree. Patreon, I've never done that, but that would be kind of cool. I should do that. I should look into that. I will. But you could smooth the little wrinkles under the eyes with that Botox. The only thing that's kind of like a little rough is if you're out there and you get that done, you're out there and you get that done in the summer months and you need to squint, it can make it a little hard to squint. So there's only a few people, right? But maybe I'll just throw it up on the phone and just hop over there. Are you on favorited or Red Note? So I downloaded Red Note, but I haven't actually got on it yet. See if I can get this little tripod going and maybe I'll hop over to IG too. Sound quality is not going to be as good. I'll warn you guys. I could maybe plug it in. So there's a lot of treatments that are like steroids, or that lack steroids, I should say. Get this thing hooked up. My phone battery is pretty low, though. I feel like I should plug this in. How quickly is it going to drain my battery to hop on IG? Let's see here. Try to get this going, guys. So any of the supporters that want to hop over to IG, I'll give you obviously the chat's going to be slower, so I won't miss your questions for one. But feel free to hop over. I'm going to kick this on. Camera's going to look way different, dude. Lighting's different. Camera's different. My camera setup's very, very nice on for TikTok. Not so nice for this. I'm going to look way different. There we go. All right. Mike's not going to be as good at either. Okay. So yeah, I get to get it on Red Note. Hey, thank you guys for being here. Dr. Greeney, board certified dermatologist, here to help you get your best skin. So thank you guys for coming in on all the platforms, live streaming on a little bit on YouTube, on TikTok, and also on Instagram. So thank you guys for being here. Feel free. Epic Burrito, thanks for the follow. Appreciate it. Carly Kramer, thanks for being here. Derek, thanks for hopping on. Mia, good to see you. Mia AZ. So thank you guys. If you guys want to hop over, give me a follow on Instagram. I don't want to lose you guys. We need to stay connected, right? So if you guys have any questions, I'm gonna take priority right now on YouTube and also on Instagram, but I'm gonna answer all of them. It's what is it? It's LOL day. Hello. Have a fabulous week. Thank you so much, Carly. Appreciate it. Thoughts? What's your topic today? I'm talking a little bit about everything. We've been just taking questions. So any questions that you guys have, and I know this is going to be very deceiving on Instagram because they're like, why do we have this nice mic and the audio quality sounds like terrible, but it's just my iPhone mic on the Instagram. So xanthelasma, I've done some cryosurgery for those. You can sometimes excise them. You can treat them with lasers. I've seen some people treat them with acids, which is terrifying. I don't think I'd want to do acids right on the eyelids like that. Thank you, Sherwin. I appreciate it. Becoming a medical assistant in dermatology, I think if you're a hard worker and you like fast-paced environment, I mean, you could do that. Those are what causes skin tags. A lot of times skin tags are worse by the rubbing and friction. We see them a lot from that. If your glucose control is not great and your blood sugars are high because of insulin resistance. Insulin, that means your body's going to make more insulin, and insulin's a growth factor and it can make those come up more. So that's how those work. Skincare products you wouldn't use. So I would probably, Sarah, just stick to mineral-based sunscreens for one. You don't want to use retinols or retinoids when you're pregnant. And a lot of the topical acne treatments like salicylic acid and benzoyl peroxide, those are technically safe in pregnancy. If you guys ever want to know like what's safe in pregnancy, you can look up something called ACOG. It's the American College of Obstetricians and Gynecologists. If you look up ACOG skincare, it will show you the things that are safe to use. So those are really, really nice options. So, which I maybe should do a video on, actually. That'd be a good idea. Getting rid of stretch marks is really tough, guys. Stretch marks are one of the hardest things to treat. You could do treatments like fractionated lasers. You can do microneedling. When stretch marks are red, you can do laser for those. Those are good options for it too. So, but it's tough. Prurigo nodularis, Chelsea, that's a great question. There's a lot of people I help with prurigo. It's a pretty common problem. See at least a couple people a week with it. But with prurigo nodularis, there are a few different things that are approved for it. There's a really great treatment called Dupixent that can really help a lot of people. So if you got like lots of lesions, like over 50 or more, that can be a really, really big help for people with prurigo. Osea brand oil and lotion. So the only lotion that I'm really big about using is oil is Drunk Elephant Marula oil. I really am a huge fan of that one. And Old Docs from WashU here. Love the show. Thanks so much. Appreciate it. Christine, thanks for being here. Despite being an old doc. Aquaphor, safer on the eyes, right? Yeah, I like Aquaphor on the eyes. These are petrolatum based, so there's no problem. If it's a little heavy there, Mia, thanks for the feedback, by the way. Best face wash. So this is coming in from Instagram, but best face wash would be, I'd say it's two. There's two really good ones out there. One of my top favorite ones of all time is CeraVe Cream to Foam Cleanser. And the second, not even the second best, these are equal, but Rock Gel to Foam Barrier Renew Cleanser. These are amazing face washes that are amazing. A Sculpture, no results after 3 months. So the question will be like, how many treatments did you have? How many vials do they do? Sculpture is something that's slow and gradual. And it's one of those things that if you get Sculptra, you want to look at it from the perspective of, if you don't do it for a long time, or if you stick with it and you look at how you age, you're going to age a hell of a lot more gracefully by doing that and stimulating collagen. Where if you don't do the Sculptra and you saw yourself after the fact, you're going to age it a lot faster. So Sculptra is a very good preventative anti-aging treatment, but it's not going to give you that day and night difference right away. So I love Sculptra overall though. Itchy scalp, I don't think that we did that yet. And me, I'm glad they're getting your son checked out. That is be good, at least to have dermatologists lay their eyes on it and kind of see what's going on. So that's really, really good. Itchy scalp, I would start with shampooing every day. I would probably start with Vichy Durcos, Vichy Durco shampoo. Use that. That would be a good idea. And then just as some people ask about it a lot, I would, a couple things I want to shout out is ScrubMD soap. So the ScrubMD soap is amazing. It's really good when it comes to things like fungal acne, is really good for things like Tenia versicolor or other types of fungal infections on the skin. So like ringworm. So if you got like a family member or something that's an like an athlete, that's definitely stuff to look at. Those are really, really good. Can pregnancy give you bad acne? It definitely can. Natural hair growth. If you're talking about natural, really probably the best thing I could tell you maybe is like rosemary oil. It's as effective as 2% minoxidil, but I would say if you're trying to grow hair, just go ahead and use what's best, which is probably going to be 5% minoxidil. So what's the best thing you can use for wrinkles on the décolletage? I think is probably what you're asking about, Rose. I like you could do injectables there to stimulate collagen. You could do laser treatments like fractionated laser, like Fraxel or Halo, and injections like things like Radius diluted. Those are good options there. There's someone asked, is there a list of products on here? There's not really a list of products on here, but if you click the link in any of my bios, you can click the link in my bios and you can just hop over to my Shop My or my Amazon store, and I have them broken down by category. So if you guys are looking for any kind of particular product, that's the best place to do it. I apply tretinoin at night and it makes my eyes burn. I avoid the eye areas that common. Well, sometimes these things can like migrate a little bit, or if you're rolling on your pillow, maybe you're getting a little on your eyelids and stuff. You could do a protective layer of lotion or things like Aquaphor, Eucerin, or Vaseline on the sensitive areas of your face, then apply the tretinoin. That way you got a little barrier in between. I think that would be a good idea. Sulfur for dermatitis. Don't know if that's particularly helpful. Wouldn't necessarily say it is, but it's good for rosacea and a little bit good for acne too. Castor oil, I'm not about it. Hydroxychloroquine side effects. It's one of the safest medicines we use. We do check the retina every now and again to make sure your retina is staying looking healthy. Thanks for all the new followers, by the way. Over 50 new followers on TikTok. I hope you guys, I hope this is not our last time on TikTok, but if it is, like I said, you guys can hop over to Instagram as well. Bags below eyes that go down the cheek. So it's really tough doing things like, for those doing things like, it's going to be like surgery, things like blepharoplasties, possibly some lasers can give you a little bit of tightening of the skin there. Can Accutane 5 milligrams be taken indefinitely for people that get acne on their back once they stop it? Low dose Accutane is used. It's a little bit of a pain in the butt to be on, but it can be done. Mercy was asking about melasma and hyperpigmentation. What can be done? Well, one of the best things that you can do is use a sunscreen for one every day. But there are a couple sunscreens that I actually just showed in my most recent video that have something called Melasil in it that can help fade hyperpigmentation. The gold standard treatment is hydroquinone, but there's a lot of really good options for fading hyperpigmentation nowadays. Another really good one that you can get over the counter is Remedy for dark spots. It's very, very good. So that's a really, really nice option too. So I check that out. Jedra's on low dose Accutane and loves it. And I agree. The people that I have that are on it, they really, really like it. Taking care of flaky scalp, I think a couple things. Briogeo Mega Strength shampoo is a good one. Doing Vichy Durco shampoo is a really good one. Washing your skin every day. The Artful Antagonist, thanks for the follow. Lots of skin tags after pregnancy. There's a lot of hormone changes during pregnancy. A lot of skin changes can happen. Sometimes moles can change color and size. You can get skin tags, these kind of things. Just go see your dermatologist when you're ready, and those can be snipped away. Calamine lotion, it's an oldie but a goodie. It's good for, you can use things like that. There we go. Sorry, I think I lost you guys on TikTok for a second. Don't know why. Small red veins on the face. Laser treatment is the best option for that. You guys can see a lot. You can see a lot of before and afters on my website of people getting treated for red spots. Acne free for a long time, keeping a little bump in my beard here and there. What's going on with there? Sometimes you can just get a little folliculitis there, Derek. I don't know if you're using CLN shampoo or CLN acne cleanser as a face wash. That might be a good way to reduce that bacteria counts in your beard area and kind of make that do better. So I may be looking to do something like that. The live froze. Hopefully the live is running again. Just let me know, because it got disconnected for a second, but I think we're in good shape now. So Anything like heal the lesion sores? Let's see. Eye bags, any advice? For eye bags or eye creams, what I'll say, there's two. I missed you too, Jero. Thanks so much for being here. And you're very welcome. I'm happy to reply and help you guys. So Jennifer Keach, shout out. What's up? Good to see you. Thanks for hopping on here. It's so good to see you. So let's see. Acne scars on the back. It's kind of hard there with acne scars on the back. I mean, you could do things to kind of fade some of the redness and stuff like that. But if they're bumped up, they can be injected with steroids. That's a nice option too. But it's tough because you're covering a broad area. But smoothing them out and reducing the redness is probably the things that you can help the most with on the back. Keratos pilaris, I like Imlactin. I like CeraVe SA lotion. These are good options. So again, eye bags. I think two things I'll shout out for eye bags is going to be Brandify Retinol Eye Serum. And again, if you use the code Greeney40 on Brandify Retinoid Eye Serum, that will save 40%. And then another great option for under the eyes is Versed Smooth Landing Retinoid Eye Balm. Can lip filler or Botox hurt your skin, internal health, or even skin long term? So fillers for sure have side effects. Probably the most common thing is something like a bruise, right? Another kind of a little bit more rare thing, but can happen, is a skin infection. And the worst thing that can happen is there have been some people, you know, that maybe 1 in 5,000 chance of blocking a blood vessel that can lead to death of the skin and a scar. And even worse than that, there's been a few people that have actually had strokes from filler injections or blindness. We never want that to happen, right? But that can happen. Botox is something where there's actually very much less risk. Botox is one of the safest, easiest, quickest things I do that makes a big difference. And Physics Ball Art says eye bag should be fixed with Lefort 3 osteotomy or even infraorbital implants, not fillers. And I agree. Almost any kind of under eye topic, I almost always talk people out of fillers. There's a few people that come in, things are mild, they got great skin. We do a little fillers, it makes it look better. But literally 80 to 90% of the time, I talk people out of fillers under the eyes, just because I don't want to make things worse. Honey is well studied, Jen, for a variety of wound healing and stuff like that. It's a great antimicrobial topical. That's very good. And but the beef tallow, I'm not really about it. I really don't like, in general, I don't like food as skincare, but décolletage wrinkles, again, rose for that. I like hyper dilute radius. I like lasers for that. It's very good. Thoughts on Botox? It's one of the best treatments that you can do. I got a face full of Botox. I love it. It naturally just kind of just relaxes away the strong muscle contractions that can lead to lines on the face. The only bad part is you kind of got to keep up with it every 3 or 4 months if you like the results. There's nothing saying that you have to keep doing it. Chemical sunscreens do get absorbed in the bloodstream. So let's see. I'm 20 and I kind of want masseter Botox. It's an easy procedure to go through, no downtime, very safe and easy to do. Botox, or the masseter, is a pretty big muscle though, so it takes a decent amount of units. I mean, you're probably not going to get out of there without using somewhere between 40 and 60 units of Botox, but especially if you have a more squarish face, you know, that's a little bit more of a masculine look. If you kind of atrophy your masseter some, get a little bit more heart-shaped face, a little bit more feminine, is very good. Where do I follow you before the ban? You guys can follow me on YouTube at SwoleMD Skincare, or hop over to Instagram where I'm also live right now at SwoleMD. If you just look up Crystal, what's up? Shout out on Instagram. Thanks for hopping on, Crystal. So the stream doesn't look quite as nice on Instagram, but that's because we're streaming on YouTube and also on TikTok live right now on my big camera. Is Desinide good for irritated skin? So for sure, Desinide is kind of a lower potency steroid that's amazing for calming inflammation in the skin. Chemical sunscreens, are they safe on the skin? As for all that we know, chemical sunscreens are perfectly safe for using. I personally use chemical sunscreens every single day of my life. I love them. They're more elegant generally. They go on nicely. They offer just as good as protection. But we do know that they are absorbed to a degree when you apply them to the skin. What we do not know and have not seen is that they cause a harm or an issue with using them. So what's the best solution for guttate psoriasis? Topical treatments. However, guttate psoriasis sometimes can be all over. So doing treatments like biologics, or potentially doing oral treatments like methotrexate, things like that can be done to help melt that away. Dr. Abruk, thanks for hopping on, brother. Just got a shout out from your colleague about AAD. So I'm looking forward to seeing you. Thanks for hopping on the live. Appreciate it. Sorry for the bad camera quality and audio quality though on IG. So live on TikTok, maybe the last stream, but I appreciate you guys. I'd love for you guys to come over to YouTube, SwoleMD Skincare on there. You're the best, brother. You're the best. Thank you so much. I appreciate it. Retinol on sensitive skin. There's a lot of great retinols that you guys can do. One of my favorites is Rock Retinol. But again, if you want to use the Brandify Retinol, that's another great option. Thank you so much. So I really like Rock Retinol. I like Rock because they do a lot of research and their skincare products are gentle on the skin. So whether it's their vitamin C or their retinol, they do studies in hundreds of people and show no irritation. They've also been some of the first people that really got into the retinol game and made it such high quality retinols that you could stabilize and put in a topical formulation and use it. So treatments for keloid scars other than surgery or injections. There are some other type of treatments you can do for keloids like radiation. So a lot of the times sometimes you do excise them, like big old ear keloids and stuff like that. Injections with steroids or things like Effudex. And then sometimes we'll do laser treatments for keloids, right? Sometimes you can do lasers over keloids with topical steroids to let that soak into the keloid to shrink those down, or do things that kind of remove the blood vessels from keloids, and that can also help those shrink down. Things like PDL laser and stuff like that. Help healing skin lesions. I'd say if you got any kind of open sores on your skin, you're always good to go with using a little bit of Vaseline on it. That's one of the best ways to help heal things. Cora says it's topical estrogen to really shrink wrinkles. So I would say overall topical estrogen is newer. There's not a ton of research on it. It's a nice adjunct. We know that skin ages a ton as our estrogen levels fall. When I say our estrogen, I usually mean female estrogen, going through menopause, things like that. So it's interesting. The question is, does it get in the skin? Does it do what it needs to do? Another question was glycolic acid versus tretinoin. If I could only pick one, it's going to be tretinoin all day. Tretinoin's a wonderful treatment overall for anti-aging and one of the best. So you guys rock. I appreciate you guys. If you're on TikTok, thanks for all the new follows on here. Almost at 10K taps on TikTok. If you guys want to tap that screen, we'll bump it up to 10K. Am I board certified? You know I'm board certified, of course. Now, I think it's become a joke on social media because now everyone says they're board certified. I even saw some nurse practitioners and stuff on here being like, "Hey, I'm board certified, dude." Everybody wants to claim it now. So maybe is it lost the flame it had? But I'll tell you what, there's still nobody better to get your recommendations from than a board certified dermatologist, and that's no joke. So you want to make sure the people you're getting treated by or the people that you are learning from they have the education, right? Because it's no short road to become a dermatologist. So make sure you know who's doing your treatments. So yeah, guys. Red light therapy for wrinkles. So Jen, I've always looked at red light therapy as the cherry on top. So photobiomodulation, that's using this red light therapy and laser therapy, and it can help to boost ATP production. So you guys know about the powerhouse of the cell. So when that red light hits that mitochondria, it boosts that ATP, it boosts that calcium in your cells and systems. It changes your gene transcription in the nucleus of your cells, and it can actually help. You've seen some dermatologists on here lately talking about red light therapy. I've got multiple videos coming up. Red light hair growth is amazing. It's good for your skin as well. So it's the cherry on top. Do the things that are low-hanging fruit, that are easy, to get, that are cheap for you. And then if you're doing all the easy, cheap stuff, go ahead and add that red light in. That's going to help you. So that is awesome, guys. I appreciate you guys being here. Thanks for those of you guys that hopped on Instagram again. Guys, follow me on Instagram, SwoleMD Skincare, SwoleMD, or just search my name, Dylan Greeney, on Instagram. Follow me on there. I hope TikTok, you know what? I'll be honest with you. 47 is going to save it. Let's be real. 47 is about to save TikTok. I know he is. He's going to save it. He's going to come through for us. He's going to get TikTok here. We're going to keep helping everybody get their best skin. I know it's going to happen. So thank you guys so much for being here. Appreciate you guys. Chemical peels, I don't know. You can do those. I like chemical peels like once a season. But if you're trying to like reverse hyperpigmentation or something like that, then Jay says TikTok's getting saved. Absolutely. So definitely. So chemical peels once a season, but if you're trying to reverse hyperpigmentation and things like that, you might want to do chemical peels every couple weeks, every 3, every 4 weeks to kind of get on top of it. So that's something that can help. Seborrheic dermatitis. There's one name of the game right now. Seborrheic dermatitis is Vichy Durcos. Vichy Durcos is the move right now on Sebderm. So thank you guys so much. You guys rock. Appreciate it. Vertical lines appearing in the upper lip. Kathleen, check out some of my before and afters. Tap the link in the bio. SwoleMDskincare.com. Look at my before and afters. Nobody's got them like I got them. Full face laser resurfacing on the lip, man. Ain't nobody can give the results like I can on the upper lip for those vertical lip lines. I'd be happy to help you. 47 will save TikTok. You got it. Absolutely, guys. Jasmine, we're pulling for him. The man, the myth. He's going to get it. I'm going to shut this down for a little bit, watch the football with the wife, hang out with the baby boy. And I love you guys. You guys are amazing. Make sure to follow YouTube, follow SwoleMD Skincare, SwoleMD on Instagram. I'm going to shut them down one by one. I'll see you guys. Thanks for hopping on. Take care. Bye-bye now. Appreciate you guys. Thanks so much for being here. You guys rock. Thank you. Thank you.